Hello, thank you so much for taking the time to watch this video. We hope that this video can help provide some education and information to you prior to undergoing your total joint replacement. We ask that you watch it prior to your surgery. Please share it with your caregiver that's going to help you through the recovery process. And hopefully this can serve as a resource throughout your recovery and preoperative preparation in order to set you up for the most success during your joint replacement procedure. First and foremost, we thank you for choosing Resurgence Orthopedics and the Lawrenceville Surgery Center, and we hope that we're going to be able to get you back to moving quickly without pain and get you back to enjoying the activities that you do on a daily basis without having any limitations. Thank you so much, and we look forward to talking with you throughout this video about the different steps in preparation and afterwards in the recovery period.
So we say before everything else, getting ready is the secret to success. That's what this video is about, to talk about what to expect before, during, and after your surgery, what your day is going to look like from start to finish, so you can be ready for this. I represent the surgery center. We've got your physician's office. We've got physical therapy. We're all working together to get you back where you want to be, pain-free, and doing the things that you want to do. A representative from the surgery center will do a lot of follow-up phone calls with you. They call in 24 hours, they call in 48 hours, and they call in a week. You also have physical therapy coming to your home the day after surgery. So we've got somebody actually laying eyes on you and checking on you as well. So start thinking about preparing your home for after surgery. I recommend that if you have a recliner, you can recover in a recliner because it's easier to get in and out of something with arms. If you don't have a recliner, you can prop up on the arm of the sofa and extend your legs out. Or if you do want to recover in your bed, it's okay, but a lot of times it's hard to get comfortable laying flat. But wherever you are, whether it's in the recliner or on the sofa or your bedroom, clear a pathway for you in a walker. Think about throw rugs, cords, potential things that you could trip on. You're also going to be up and walking around a bit after surgery. So if it's a big open area like family room to dining room to kitchen or up and down a hallway, clear pathway for you in that walker. A week prior to surgery, we want you to stop taking any NSAIDs. That's a lead, ibuprofen, Motrin, prescription NSAIDs or meloxicam, Celebrex, any of those medications. Also, we want you to stop any supplements and vitamins that you're taking, especially things like glucosamine and fish oil. 3 days prior to surgery, you're going to start showering with this HIPAA cleanse. There's an additional video that you'll watch that will explain that. 24 hours prior to surgery, we say no alcoholic beverages and no tobacco product. Let us know if you have any changes in your health. You don't want to be fighting the flu, an upper respiratory infection. For ladies, urinary tract infection is a big deal. So just reach out to the physician's office. You might have to be rescheduled.
So now we're going to go over some preparations for before your surgery. So you likely already have one of these folders here. Inside your folder, it should have a Ziploc baggie of these nasal swabs, okay? So you have 5 of them here. So 1 swab is going to go into each of your nostrils. So 1 swab for both, okay? So the reason that we do this before surgery is because you can have a bacteria that lives in your nostrils called MRSA. Some people are carriers of it, and so we want to decolonize it prior to surgery, meaning get rid of it. So I'm going to demonstrate how to use this nasal swab today. So basically you're gonna open it up like this, push it through. You're gonna see a little cotton tip at the end there, okay? And then there's a little circle on here, and that's what you're gonna squeeze, and it's gonna break the glass. Did you hear that? And then you turn it over, and then all that liquid, sometimes you gotta push it, but all the liquid is gonna come out on that cotton tip there, okay? And then for each nostril, you're gonna take it, you're gonna swirl it around. 1, 2, 3, 1, 2, 3, and then throw that away. And then you should have 4 left. So 4 days before surgery, you'll start doing the next one. And then 3, and then 2, and then so on. probably already read through the packet and you notice that you have to have labs done before your surgery. So this is very important to have these labs done 10 to 14 days before surgery. And so there's 3 options to have these labs done. You can go to Quest, LabCorp, or you could just bring it to your primary care provider. For LabCorp, we recommend if you have United Healthcare, Blue Cross, or Cigna, go to LabCorp. If your insurance is Aetna or Humana, you can go to Quest. You could also bring it to your primary care provider if you would like. When you go get those labs done, you need to make sure that you bring your referral for the labs that you should have gotten at your pre-op appointment, along with your insurance card. That's very important. Okay, so now that you've read through the lab orders, the next step on your packet is the shopping list. So there's a few things we recommend getting prior to surgery. You can get these at CVS, Target, Walmart, Walgreens, pretty much any drugstore or grocery store. So the first listed is going to be a stool softener. So you can get Dulcolax, Colace, or Miralax, and that's to help with constipation after surgery because the anesthesia can cause that as well as your pain meds. The next is going to be that Hibiclens. So if you did not receive the Hibiclens at your pre-op visit, then you can get that over the counter, like I said, at any big drugstore or grocery store, and that's listed here. Additionally, we recommend you get a loofah. That's easier to put the Hibiclens on, as well as getting over-the-counter Tylenol and ibuprofen just to have on hand.
Day of surgery, you're going to bring your photo ID, your insurance card, a case for your glasses or dentures. We talked about what to wear, something loose and comfortable. Leave all your jewelry, your valuables, all your medications at home. We take care of your medications here. If you use a CPAP machine, bring it to surgery with you. Also, if you use any inhalers, rescue inhalers, bring that with you as well. Nothing to eat after midnight. You can have water only up until 2 hours before your arrival time. So once we get your pain under control, we get you dressed on the stretcher. So think about this, something that's going to be comfortable, especially when you get home and you can recover at home and not have to change clothes. For hips, we recommend you wear something with an elastic waist, something that's easy to slide down so we can check the incision site. Knees, we need access to your knee after surgery. So preferably we'd like you to, if it's cold and you want to come in sweatpants or pants, but bring some shorts to go home in. So once we get you dressed, then we're going to sit you on the side of the stretcher. There's something called a gait belt that we put around you. It's got these handles in the back. You're going to use our walker while you're here. So keep your walker in the car to get you from the car and into the house. So when you get here morning of surgery, we're going to bring you back. Family members don't come back with you initially. Once you're completely ready for surgery, they'll be able to come and sit with you till time to go back to the operating room. Now, family members are welcome to stay here. If you live close by, they're welcome to go home. And the nurse that's caring for you will give them updates with your progress. And as soon as it's time for you to be discharged, we'll call and tell them to head this way. Once you get here, we bring you back. We get you in a hospital gown. We start your IV. You're going to meet a lot of people. Pre-op staff, anesthesiologists, and the OR staff. You'll have a wristband on and everyone is going to ask you what's your name, what's your date of birth, and what you haven't done. That's just one of our safety checks. You will not go back for surgery until you see your surgeon and he marks your operative site.
So you just finished your surgery. Surgery itself takes about an hour to an hour and a half. And after surgery, you'll be wheeled into the recovery room. When you first get there, our main thing is to keep you comfortable. So we'll be monitoring your vital signs and just letting you rest for the first little bit. We're mainly waiting for your spinal anesthetic block to wear off and to make sure that you can wiggle your toes and start recovery from your feet and legs. Once that happens, we'll make sure that you can start eating and drinking things. We'll sit you up, and once you're more awake, we'll make sure that you can take down some crackers and ginger ale and just make sure that you're feeling better. We'll get some oral pain medications on board, and then once you're feeling good and you're feeling strong and your legs have recovered, we're going to get you to sit up to the side of the bed and just see how you feel. We will then get a walker in front of you and have you stand up, and we'll kind of see how you feel, if you feel comfortable standing, if you have your balance back. And if you don't, that's no big deal. We'll have you sit down in a large recliner and just have a little bit more time to recover. But if you do feel good, if you feel strong and your leg recovery has come back, then we'll get you up walking. So we'll put a gait belt around your waist, and using the walker with you at both sides, we'll have 2 nurses with you supporting you, and we'll start getting you to walk. Your main goals with walking, there's about 150 feet that we'll want you to walk. And so we'll have you slowly walk with the walker at your own pace, making sure you feel comfortable, your legs aren't buckling, and they feel solid. Your halfway point of that walking session is a little flight of stairs. So we'll make sure that you can go up and down some stairs, make sure that you're comfortable navigating those. And throughout that process, we're doing that at your own pace, making sure your pain is controlled and you feel strong. Once you accomplish that, there are really 4 main objectives we need to complete before sending you home. The first is that you're keeping down those clear liquids and those crackers and foods that we gave you initially after surgery. The second is that your pain is controlled on oral pain medications. The third is that you've completed that 150 feet of ambulation. And then the fourth thing is just that you're able to pee before you go home so that there's no urinary retention. If you've been able to accomplish those 4 tasks, then we'll set you home. The average patient is able to go home 1 to 2 hours after surgery, but if it takes you a little longer, there's no worries. We're here to make sure that when you go home, you feel comfortable and we're setting you up for success.
Hello, I'm Dr. David Apatov, and I'm one of the anesthesiologists at Lawrenceville Surgery Center. I want to take this moment to talk to you about the anesthesia side of things for when you come visit us for your total joint replacement. First off, I do want to remind you, please do not eat anything 8 hours prior to arriving for surgery. I do, however, want to encourage you to drink clear liquids up until 2 hours before you arrive for surgery. By clear liquids, that means please nothing with pulp, nothing with any sort of particulate matter, and nothing with any sort of dairy products prior to surgery. Water, Powerade, Gatorade are all great options. When you arrive at the Lawrenceville Surgery Center, you'll meet your anesthesiologist. He or she will talk to you about your medical history, your surgical history, allergies, and potentially any issues you had with anesthesia in the past. He or she will then talk to you about the anesthesia plan. Depending on what type of total joint you're receiving, you may be eligible to receive what's called a peripheral nerve block. A peripheral nerve block is an injection of numbing medicine that helps a lot with pain after the surgery, usually for about 12 and 24 hours. If you're not eligible to receive a peripheral nerve block, you will instead receive local anesthetic injections during surgery by the surgeon that will also help a lot with pain after the surgery. The anesthesiologist will then talk to you about a spinal anesthetic for the surgery. Our anesthesia group prefers performing a spinal anesthetic for total joint replacements because there are proven benefits to receiving a spinal for this type of surgery. Those benefits include less nausea vomiting after surgery, less cognitive dysfunction or brain fog after surgery, and potentially even better pain control after surgery. For the spinal, what we do is we bring you into the operating room, sit you up on the operating room table, give you some good relaxing medicine so you're very relaxed and comfortable, and then you'll just feel a pinch and a burn and some pressure in the back as we perform the procedure. Sometimes the spinal is difficult to place or doesn't work as well as we would like. Also, other times you have the right to refuse a spinal anesthetic, and if that were to happen, if any of those things were to happen, we would then resort to our backup plan, which is general anesthesia, where we put you totally off to sleep and put a breathing device in your mouth to help you breathe during the surgery. Once the surgery is over with, we'll bring you to the recovery room. Assuming you received a spinal anesthetic, your legs will still be very weak and numb for about 20 to 30 minutes after the surgery. The spinal will eventually wear off, and when it does, you will regain your sensation and strength in your lower extremities. You may start to experience some pain when the spinal wears off, so we'll have plenty of pain meds available for you if you need them. Just ask for them if you need them. Once you're doing well with pain, we'll help you stand up and walk around the surgery center, and then you should be about ready to go home. We look forward to helping you get through your total joint replacement, and we'll see you soon.
All right, we're we're going to talk about your activity once you get home. Now, the day of surgery, you're going to be worn out, you're going to be tired, you get in the recliner, you get in your bed, and you're going to sleep. That night, you'll have to get up and walk around a little bit because you're going to have to go to the bathroom. But the next day after surgery, anytime you're awake, we want you to get up and walk every hour. Even just family room to dining room to kitchen, up and down a hallway, short, frequent walks is what we want. Also, for knees, you're going to elevate. We want you to put something under your heel and your ankle. Don't put a pillow under your knee. We want your leg really straight after surgery. Hips, if it helps to put a pillow under your knee to take that pressure off your hip on the operative side, it's certainly fine to do that. Also, you're going to ice. I say ice, 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 ice. There's no such thing as icing too much. Don't even worry about 20 minutes on and 20 minutes off. Make sure you've got a barrier between your skin and the area that you're icing, but it's going to help with the swelling and it's going to help with the discomfort.
Congratulations, you're done with your surgery. Now we've got to figure out how to control your pain post-operatively. So the first day, you're gonna actually, hopefully, be pretty comfortable. That's because the nerve block is currently in effect and we injected a bunch of local anesthetic around your joint replacement. That slowly wears off over the first 12 to 24 hours, and so we want you to stay ahead of your pain. First thing I tell patients to focus on is ice. Ice, ice, ice as much as possible for the first 3 to 4 days. That will help to reduce swelling, inflammation, and also overall help with your pain. In addition to that, we use a multimodal pain therapy afterwards. In preparation for your surgery, we do recommend you getting some anti-inflammatories, either ibuprofen or naproxen over the counter ahead of time, as well as Tylenol. And if you're able to do that, if you don't have any contraindications to taking an anti-inflammatory, we do recommend you starting with that pretty quickly upon getting home, alternating between ibuprofen and Tylenol every 4 hours, alternating one or the other to help start controlling your pain. In addition to that, we will also provide you additional medications in the form of narcotics. Now that's usually either hydrocodone or Norco in hip replacements and oxycodone or Percocet in knee replacements. Those we like you to start taking to get ahead of your pain initially, and really using those to control your pain when it's really breakthrough or the ibuprofen or Tylenol are not working. In addition to that, if later on you start developing shooting pains or nerve-like pains that are tingling in nature, that's something that you can reach out to our team for. Usually we would prescribe you a anti-nerve medicine like a gabapentin or Lyrica if that is the case. But again, that's a very rare percentage of people. Majority of people, really, the ice, the anti-inflammatories, and the Tylenol are very effective. And then we do use those narcotics for a few days afterwards, but most patients are getting off of the narcotics and only needing that for the first 7 to 10 days.
We're doing several things to avoid blood clots. One thing, you're going to wake up with compression socks on. We provide those here at the surgery center. Along with that, you're going to have on some of those little hospital non-slip socks. You're going to wear those compression socks all the time for 2 weeks. You take them off to take a shower, or if you feel like you need to wash them, you can hand wash them, let them air dry, but you're going to put them back on. Most physicians are going to prescribe aspirin twice a day for several weeks. That's an oral anticoagulant. The other thing we do to prevent blood clots is getting up and moving. Early ambulation is really, really important. So let's talk about signs and symptoms of a blood clot. They usually occur in your extremity, pretty rarely behind your arm. It's typically in your calf. It does not have to be on the surgical side. It can occur in the other leg. Pain in your calf, swelling, feels like a cramp that's not going away. You wouldn't be able to put weight on that leg. You might even have a red spot in the back of your leg. We recommend that if you're having any symptoms like that, you're going to call your physician's office. They will probably send you to the emergency room. If we don't address that, and that blood clot goes to your heart and lungs, you might have shortness of breath, sudden onset of chest pain, cough you didn't have before. That is a 911 call.
Okay, so now we're going to talk about the 2 different dressing types that you'll have after surgery. So both of the dressings you can leave on for 14 days. Both you're able to shower with, so they are waterproof, and we'll go over each of them. So we do place them both on in the operating room in a sterile environment. So like I said, you don't do anything with it, you'll leave it on for 14 days. I'll show you, the first one is an Aquacel dressing, and I'm gonna place it on my lovely patient here. And so like I said, we do this in the OR in a sterile environment. So I'm placing it on my patient here. And so you can see here that there's no drainage. This looks perfect. If you do have some drainage, you'll be able to see it through this area here. If it's only a little bit, that's fine, but if it goes all the way out to the edges there, you have to call and let me know so that we can change it. The other type of dressing is called a Pico dressing. And so it looks like this, and you get this little battery pack with it. So this helps with wound healing. So when you're looking at it, it's making this noise because it's not on anyone. But when you have it on, it shouldn't make any noise, and it should have this green OK blinking. There should be no other colors blinking here, just the green OK. Again, you can shower with this on, but you do have to remove it. And so you can pull it from this section here and remove it like that, or you can remove it on this one and you just twist it and take it off. And then that way you can shower with this on. Okay, so fast forward now and we're at your 2-week post-operative visit. What's gonna happen then? So you come in and you still have your Aquacel bandage on. And so what we're gonna do at your 2-week visit is we actually take it off. And so it's a relatively simple bandage to take off. And so take it off, and then you shouldn't have to put any bandage on after that. Incision care wise, you can shower normally with soap and water, no bath, no pool, no hot tub. At 2 weeks, we don't want you submerging the incision in any type of body of water. Additionally, it's not ready to put any ointments or creams, no vitamin E oil, no Mederma at that point. Usually it needs to be fully healed by, 3 to 4 weeks later or so. And so that's when we take your bandage off. We'll also get x-rays at that time, make sure everything looks good.
So during your preoperative visit, there's a couple things that we'll talk to you regarding durable medical equipment. Those are the things that help you during your recovery to get your mobilization back and get moving. The first thing that we feel like is important after every joint replacement is a rolling walker. This is something that will help with your balance and stability as you're regaining your function for the first few days after surgery. The second thing is a cane, which is usually what we transition to after you master the rolling walker. And again, the walker you're going to use for a week or two, then transition to the cane for a week or two. And so those are 2 DME items that we do recommend having after surgery. Other items that we do think are also beneficial are if you have low toilet seats, an elevated toilet seat that could be added to your toilet so you're not having to bend down as much when going to the bathroom, or a 3-in-1 commode if you have an area that it's hard to access your bathroom immediately after surgery. Another thing that patients seek benefit for is if you have a shower where you can't sit during the shower, sometimes a shower chair can be beneficial to help with stability if you have issues standing after surgery. Other items that can be helpful include additional compression socks to wear for the first 2 weeks, which help reduce your risk of blood clot. And then finally, an item that I really think is very beneficial is some sort of cold therapy unit for either your hip or your knee. That can be something as simple as an ice pack, or some patients enjoy getting an ice machine. And the ice really helps with analgesia, helping to keep pain down for the first 2 to 3 weeks after surgery. And that's another thing that we provide. All of these durable medical equipment items are variable as to what insurance covers and what it doesn't. So you'll have a one-on-one appointment with our DME coordinator to go through that, which will review your different options on obtaining these items and seeing if your insurance will cover them. But just wanted to give you an idea of what to expect during that part and things to prepare prior to joint replacement. Of note, people that are getting hip replacements, we also have something called a hip kit, which helps patients to avoid bending and that sort of stuff after surgery. So these are some items. We look forward to discussing them with you further. Thank you. So one of the things that I want to talk with you all about is driving restrictions after joint replacement. That's one of the most common questions that we get asked. And so when we think about joint replacement and driving restrictions, there are a couple of rules prior to letting you get back on the road. The first is you need to be off all narcotics prior to driving. And so everybody's a little different how quickly they get off narcotics. Some people are only on narcotics for a few days, but a majority of people after about 10 to 14 days are completely off of narcotics. The other thing to think about is the laterality of your joint replacement. So usually people that have a joint replacement on their left side, because that's not their driving leg, are usually back to driving within about a week. With regards to the right side, that can be something that can take a little longer, closer to 2 to 3 weeks. And of course, it's going to have to do with how long you're going to drive, if you're driving professionally or just around the neighborhood. And so I tell people with the right hip, really plan, right hip or knee, plan for a 2 to 3 weeks of not driving. And then gradually, if you're off narcotics and you're feeling good, try driving around the neighborhood and see how you feel. Ultimately, it's going to be up to you when you feel comfortable driving, but A, we need to be off narcotics. B, we need you to feel comfortable getting in and out of the car on your own. That's probably the secondary thing. And then the third thing is we need to be making sure that you feel comfortable if, God forbid, somebody slammed in front of you, that you were able to have a quick reaction time to slam on the brakes. So that's usually the guidance I give to patients prior to resuming driving after joint replacement. Feel free to ask us any additional questions about that in the future. Thank you so much for your time, and thank you for watching this joint replacement video. Our hope is that this video can serve as a resource for both yourself and your caregiver as you go throughout this joint replacement recovery and get you back to enjoying the activities that you love. Please do not hesitate to reach out to any member of your physician's team throughout this process if any additional questions come up. And again, our goal is to get you back and doing what you love. Thank you so much.